Hi guys, my name is Sass. I'm a nurse practitioner at Peacock Pediatrics, and today I'm going to talk to you guys about depression and anxiety. So this is something that can be seen in the pediatric population, and we want you to know kind of the symptoms of it and the warning signs and when to be seen. So some symptoms of depression, or the signs and symptoms of depression, can be that the child is sad or in a bad mood, irritable, having weight loss or weight gain, sleeping too much or not at all, being restless, getting poor grades in school, a loss of interest of things that they used to enjoy, kind of communicating thoughts of death or suicide is a really big red flag. And there are lots of things that can cause depression, and it can run in your family. So some kids are just more prone to suffer from anxiety and depression. There can be too many or not enough chemicals in the brain. Things that a child is suffering through, so a recent death, trouble in school, issues with bullying, abuse, certain medications, a lot of things can cause it, and we just want you to make sure your child knows they're not alone, and there are things that we can do to help. So some kids that are suffering from anxiety, you may notice they have irrational fears, or they're grinding their teeth or really afraid of certain things, not sleeping, trouble focusing or making decisions. We do start screening kids at their well child checks, but if you have a concern and they're not due for a well child check, we'd want you to absolutely call and make an appointment. If your child does communicate thoughts of suicide, we want you to be seen immediately. If the clinic isn't open, we'd want you to take him into the emergency room if you're worried. We want you to take suicidal thoughts very seriously, and always feel free to call your healthcare provider if you're seeing some of these red flags and you want to be seen more urgently. Absolutely take those seriously and get in to be seen. There are things we can do. There are resources, there are medications, therapy, lifestyle modifications, all sorts of things that we have to offer. So we do not want you or your child to be suffering in silence. We want you to talk about it, and we want to be able to help. So if you guys need anything at all, please call. If you have questions or concerns, we'd be happy to walk you through them.